A recidivism risk assessment is a methodology used within the criminal justice system to evaluate the probability that a convicted individual will commit another crime. These assessments aim to replace or supplement subjective human judgment with a more standardized, evidence-based approach. They typically analyze a combination of factors, which are divided into two categories, static and dynamic. Static factors are historical and unchangeable, such as the age at first arrest, prior convictions, and criminal history. Dynamic factors are changeable and related to an individual's current circumstances and mindset, including substance abuse, employment status, housing stability, and antisocial associations. By weighing these variables, the assessment produces a score that classifies an individual as low, moderate, or high risk for reoffending. The practical applications of these assessments are significant. They are used to inform critical decisions at various stages of the legal process. During pre-trial hearings, a risk score can help a judge determine whether an individual should be released on bail or detained. At sentencing, it can influence the type and severity of the penalty. In corrections and parole, it identifies which inmates might benefit most from rehabilitation programs and helps determine the timing and conditions of release into the community. The origins of formal risk assessment trace back to the 1920s. A pivotal moment came in 1928 with the work of sociologist Ernest W. Burgess. While studying the parole systems of Illinois prisons, he developed a method to predict parole success or failure based on 21 different factors, including the nature of the crime and the individual's work history. This Burgess method was a landmark innovation, as it represented the first systematic attempt to quantify the risk of recidivism using actuarial tables and empirical data, moving the field away from purely discretionary decision-making toward more structure.